Thank you, Chairman Baker, Chairman Fabrizio, members of the Health and Human Services Committee. Appreciate the opportunity to discuss House Bill 1354. Basically, it has two goals. Number one, improve health outcomes for our medical assistance programs, and two, try to provide some budgetary consistency within those programs moving forward. If you go through the bill, there's significant opportunities for healthcare savings through proven programs that have worked. If you look at the evidence-based programs, obviously you want to make sure any program started actually work. For the first time ever, requires a uniform continuity of care to ensure there's a holistic approach to health coordination between all of our medical assistance programs. On top of the requirements of the contracts, requires each agency to actually, the director of this new agency to actually require continuity of care between state agencies to improve healthcare outcomes. Medical homes, which was adopted in the amendment, is a requirement of the contracts. That alone, on December 15, 2011, Milliman released a study showing North Carolina increased healthcare outcomes for over 1.1 million people enrolled in their medical homes program at a cost savings of $984 million between 2007 and 2010. Quote, expected outcomes to improve health and well-being of the residents of this Commonwealth is a primary goal of this office moving forward. And I think there's robust research and data from numerous nonpartisan sites showing that the better job controlling the healthcare, creating better healthcare outcomes for residents within our medical assistance programs will drive lower costs moving forward. So I appreciate the committee's taking this bill up.
Thank you, Representative Grove. Any questions, comments on the legislation? Representative Delicio.
Thank you. Missed the part about medical homes being in the amendment. I don't seem to have a copy of the amendment. And
notice beforehand?
That in the oral narrative, I guess. My bad. Thank you. Anyhow, just to be clear, this currently falls within the purview of the Secretary of the Department of Human Services, which is a function of the executive branch. Mm-hmm. This would totally take control out of these Medicaid programs, out of the executive branch, putting it into this independent branch. It sounds like categorically and across the board. Am I understanding that correctly?
Yeah, it would move maintaining and operating the medical assistance programs under this office.
Okay, and
but it will be housed. It will be, for budgetary reasons, it will be within Department of Human Services.
See that.
And then they are required to coordinate all their efforts with all the agencies.
Got it. Can you also speak to how this fits in with this concept of unification and consolidation of those four agencies that some of us have been attending hearings to, have attended briefings? Has that come up in any of these hearings or briefings? And is this then a whole new concept to that unification discussion that's been ongoing?
It can work within the unification or outside of the unification, either way. I believe under the unification, there's an Office of Managed Medical Assistance Programs being created. This would basically take that place of that entity.
Nothing more at this time, Mr. Chairman. Thank you.
Thank you. Representative Daley.
Thank you, Mr. Chairman. Representative Grove, thank you for your bill. In the analysis, I'm not sure who's the right person to answer this, but in the analysis of this bill, it says the Office of Independent Medicaid Director shall use encumbered funds appropriated to DHS to implement this article. So I'm curious, does that mean encumbered in the typical way that funds are encumbered in a budget? And when will these funds be appropriated to DHS?
Basically, I think in the adopted language, we do a transfer of funds. So you have the current medical assistance programs, all the funds associated with managing, operating, everything from IT costs to personnel costs would be transferred from where it currently is housed in DHS to this. So that's just making sure there's no duplication of services, making sure that this independent agency has purview over those funds moving forward.
So does that mean that they would have a separate budget?
No, for budgetary purposes, it would be under DHS. So if you're on a so if you would get the appropriations booklet under Department of Human Services, all these line items would still be under Department of Human Services. They would just be administered by this independent office.
So thank you, but I'm just still trying to understand, because would we be hiring a completely one new person to be doing this work?
Potentially, they could. I mean, the nominee could be the current, what's designated as our medical assistance director currently. They could move over to that spot through the nomination process.
The nomination process, but it would be a reduction of work by the current, whoever happens to.
So all the functions of the medical assistance programs currently would be under this jurisdiction. So take all those programs, all the costs of those programs would be administered by the Office of Independent Director. So all the staff, all the computer-based systems would be directed by this independent office rather than DHS on its own. Potentially, you could have one new hiree in the director, but again, through the nomination process, you could put the current Medicaid director in that position.
All right, and I apologize if I'm going to ask you to repeat something that Representative Delisio asked, but regarding how it fits in with the current plans for integration of the 4 departments, could you just explain again how
Yes.
that would work?
So-
And is this already contemplated within the administration's plans?
So from my understanding of the administration's plans, it may be as good as yours, depending on how heavy you've delved into it. My understanding is there is a Office of Medical Assistance Programs that's currently, there's a current one, and then there's the administration plans on creating their own, which if you take that chart and kind of project it out, there's an Office of Medical Assistance Programs already. This could easily fit in the place of that. So whether unification happens or does not happen, under this bill, there would be an independent Office of Medical Assistance Programs.
But if this bill were to go through, the person in that position, the independent director, would no longer fit into that giant chart, or would they be
So it would be out
responsible
in.
to, let me just, I'm
Yeah,
sorry, but
I
let
mean,
me,
they're independent, so they would be within the DHS. They wouldn't answer directly to the secretary, so they wouldn't be in that line of charts, but they would be under Department of Human Services as far as their budget goes. It would still be housed under DHS.
so my recollection, though, of the charts.
So you could do.
Can I, you know what, I want to make sure we're talking about the same thing, and I'm able to finish asking my
Yeah.
question. There are some, in the way that I've seen some of the charts, there do seem to be some upper-level positions that would report directly to the governor. So that's
this-
what I'm trying to get to.
Yeah, so they would be independent. The governor would obviously have a say in who that individual is, but they would operate independently. Think about it as the Open Records Director or Independent Fiscal Office Director. Probably Open Records is the best example because they're housed in DCED. So when you go through the tracking run of the budget, you'll see the Open Records Office is in there. They don't report to the Secretary of DCED, but the management of their budget, their allocation of the budget comes from DCED itself, just as a point in time. This would be similar to that approach, where all your budgetary tracking runs, budget book, everything would have that office built into it, but they would operate independently outside of the secretary, but coordinate. They're mandated to coordinate with the secretary, with Department of Aging, with DDAP, with health, et cetera.
Okay. Can I ask one more? I think this is a short question. So when was this bill passed in North Carolina?
Good question. Was it 2011, 2012, 2013, 2014? It was 2015.
It's
2000
just,
15 or
it's shortly
15.
been, it's been
Yeah.
over, just about over a year
Yeah.
for the data to come in.
Okay, so there's 1 year of data.
That is correct.
Okay, thank you.
Representative Schlossberg.
Thank you, Chairman. And Representative Grove, a question. First, let me just make sure my basic understanding, is it, hello?
I think it is. It's just low.
I've never been told I'm quiet in
I
my
can hear
entire
you, Mike
life.
Schlossberg. I can hear you, buddy.
Okay, that's good. Thank you. So, basic understanding question: this bill would take the office, of Medicaid essentially, and move it out of the governor's purview and as to an independent agency, now no longer answerable to the governor. Amendments to state plan for Medicaid programs. The director of this would have essentially carte blanche to revise the state Medicaid plan however he or she chooses.
Yeah. Now, current state law, CMS, each state has one person designated to change that state plan currently. So we have one person. I believe her name is Lisa Allen, and she's been working for DHS for multiple administrations.
Sure.
She currently has been designated by the governor as the sole provider of state plan changes. And that's a federal requirement, so the federal government only has to deal with one person per state. So they work to the if they can make changes, but normally it's driven by a governor to make those changes moving forward. So that person would be moved out of that role, still have the ability to change those state plans within changes of state law. So there's no unilateral change of state plans directed by the executive branch. So it would empower the legislature more to take an active role in managing those plans moving forward.
And in so doing, remove the governor more from the equation of Medicaid plans. Okay, thank you.
Point of clarification, Representative Grove, and I don't think the amendment changed anything, but the majority and minority chairs of the enumerated committees actually make the recommendations.
Yep, they're part of it.
And the governor is the one who actually makes the selection, and then that is subject to the confirmation process
By
of
the
the
Senate.
Senate, correct?
Yep.
Okay.
Yep. And the goal of that is to try to provide some policy stability in between administrations, so you don't have huge policy changes that add or change benefits just willy-nilly per the administration. Because right now, I mean, you don't have a say in what that state plan changes. At any time, the administration can submit plan changes outside the purview of this General Assembly at any cost or cost reduction that may so entail. So this provides more continuity between administrations and for the General Assembly to better manage those programs moving forward.
Thank you. Seeing no other questions or comments, we'll have a roll call vote on this one. Yes.